All right, hepatitis B. Okay, so you spread it by what? It's B and D, so it's blood and, sorry, it's body fluids, blood and secretions. So it's blood and C for secretions, right? So blood and secretions get into open skin, into areas that are in contact with blood. And how do you get blood contact? That'd be with a needle, right? So needle sharing. If you have razors, you're sharing razors at the frat house, right? It's like, are you done with that, boy or dude? Let's go ahead and shave again, all right? So that's not a good practice, all right? Sharing toothbrushes is also not a good practice, right? That is body fluids that you're sharing, okay? So you got blood, you got needle stick injury, you got needle sharing, razor sharing. Sex also is blood sharing. Right? It's not like where you before you have sex, you have to do like and cut your hand like Indiana Jones. You don't have to do that, and that's also not a good idea. Please don't do that. Where you're as a kid, or you cut your hand and you share blood like in every movie ever. But anyways, there's also sex is not a what's the word? A gentle activity, right? So there can be mucous membrane tearing, and there can be blood sharing, right? So that's why condoms would be recommended in that case. All right. What else on this? So there is a vaccine required for healthcare workers because they have needle stick injuries, not because they have sex, but because they have needle stick injuries. All right, so they're required to, and just in case they do get a needle stick, which happens, right? We've had one recently where the nurse there's a needle sticking up in the sharps container, and he's like, oh, try to push it back in, and then he was off work for 3 weeks for light duty. It's like, did you hurt your feet? I thought, why can't you work on the floor? Anyways, so it's like you just put a Band-Aid on. Anyways, he has to get tested for hepatitis B, and hepatitis C, as we'll find out, can also be found in blood, right? So that is introduction of the needle into the skin, right? What else? So blood transfusions can also do it. So you get a blood transfusion, that's going to possibly get you hepatitis B. It can also get you hepatitis C or even HIV. HIV is also bloodborne, right? As far as like which one's which, right? So if you get a blood transfusion, it's like 1 in a million that you get hepatitis B. For HIV, it's 1 in 21 million, and there hasn't been a documented case like 2002. So it's been 21 years almost since we had HIV contracted from blood transfusion. All right, we usually check blood before we give it. So when you donate blood, right, they say, good job, okay, let's test it. That guy looks suspicious, right? So they test it for hepatitis B. They test it for HIV, right? You get what do you get, candy and brownies, right? All right, anyways, so you can get the vaccine, and that will reduce the chances of getting a hepatitis B infection, okay? And what else? So, yeah, so also hepatitis B is much more infectious than HIV and hepatitis C. It can live on surfaces for 7 days outside the body, and it's 50 to 100 times more infective than HIV. So anal sex is 18 times more at risk than vaginal sex. One, there's more mucous membrane tearing with anal sex compared to vaginal sex. Also, the vaginal secretions have a lot more autoimmune solutions and liquids that are going to eradicate hepatitis B. Okay, so men having sex with men, or MSM, they're a very, very high risk, and it's actually underreported as well. All right, so body fluids. So not only can you get blood mixtures, but also hepatitis B can make its way into secretions, such as vaginal secretions, such as oral secretions, and all these can be also mixed up in sexual activities. Right, so semen, saliva, etc. Also, infected fluids like drains. So you have a drain. That's why you wear what before you touch a drain, or any kind of thing that could get your hands juicy? You wear gloves, right? And mucous membranes also can transmit it. All right, so hepatitis B can be acute. It's not as common, but if it did have an acute infection, it would have the viral prodrome, which is your flu-like symptoms. What are flu-like symptoms again? You got fever, malaise, chills, fatigue, arthralgia, right? So those are all, you'll get the viral symptoms, plus you'll get jaundice symptoms, which are what? Yellow icteric skin, sclera. What else? Imagine the poop getting everywhere. It's going to cause itchiness, right? Right. If you don't wipe after the bathroom, right? If you're just like swamping it all the way, that's going to start causing some. That's going to cause some itchiness at the end of the day, right? So yeah, so that's going to cause itchy pruritus. And what else? Clay-colored stools. right? And dark urine. Those are all jaundice symptoms. So it's all just copy and pasting, right? All right, so there we got hepatitis B, D, and C. And for hepatitis D as an aside, we'll point it out also, you can't get hepatitis D unless you also have an active hepatitis B infection. So that's why it's kind of grouped together. Okay, so pregnant moms are at high risk of giving hepatitis B to their baby. One, because vaginal births are not bloodless, right? So there can be blood contact at that point, right? So the baby is going to get tested, and mom's going to get tested. If mom has an active infection, we have to give baby, we're going to give mom prophylaxis as well, but baby especially needs it. Okay, so we got toothbrushes. Why do we have toothbrushes there? Don't share them because you can transmit it by secretions, right? Also needles. What's the deal with needles? Don't share them. Sharing is not caring. What else? What about recapping them? They got some gloves on, but you can glove all day long, but if you recap it with 2 hands, what do you put yourself at risk for? A needle stick injury. Okay, so remember one of our hepatitises are a DNA, and that one is hepatitis B, okay, is a DNA. So we have to look at the layout of the hepatitis B molecule because we can form antibodies against any part of it, basically. So there is the surface antigen out over here, medium surface. So you get the surface protein, that's surface antigen. So we can measure it, but also we can form antibodies against it, right? We can measure what are called the core antigens right here. So the core antigens, we can measure core antigens, and we can form antibodies against it. So antibody for HBV, anti-HBV against the hepatitis B core antigen. So this, like I told you, it's going to get crazy. And then you have a envelope protein, which is inside. And you can measure the antigen, and you can also measure the antibody against that. Luckily, we don't worry about that. We're only going to worry about core and surface antigens and core and surface antibodies, right? And also, we can measure how much DNA there is of the hepatitis B. Okay? So this next slide is, we'll take a break after. All right? So hepatitis B, how do you get hepatitis B in the first place? Well, it's going to get its way into the bloodstream. How? Via a break in skin, via blood-to-blood contact, right? Blood and secretions. And it makes its way in. And when it makes its way in, it's a DNA molecule. So since it's a DNA molecule, DNA usually belongs in the nucleus, right? It gets into the nucleus, and it's going to cause it's going to integrate itself into the nucleus. And when you do that, it fools the liver cell until it gets apoptosed. But it fools the liver cell, and the whole purpose of a DNA is to provide the instructions for proteins, right? So the cell's RNA goes up there, blueprints it, like silly putties it, and goes out and makes the protein. Little did it know it made hepatitis B virus, right? And then now that can then proliferate. All right, so again, hepatitis D, the only reason why we get Hep D is when you have Hep B, okay? So once inside, it's going to then break apart, and there's all kinds of things that can be there. There's 3 antigens, which we talked about. There's the which ones? Core, surface, and envelope. We don't care about envelope, but core and surface you can measure. And you can form antibodies against them, right? And it takes a second to make antibodies, right? So antibody against the E, right? Antibody against the C, antibody against the, again, E, we're not too worried about, but C, core antibody, and surface antibody we can form antibodies against, right? And the nomenclature, like I mentioned before, is the same as HIV, but we're just going to add to it. So we have antibody against HBV, but what part of the HBV? Are we doing the core, right? Are we doing the surface, or are we doing the envelope, right? So anti-HB, right? C is the antibody against the hepatitis B core antigen. I don't want to say antigen because it confuse antigen and antibodies. Okay. All right, diagnostic tests. So how do you know someone has an infection? Well, you can measure the antigens. If they have the antigens present, the only reason why the antigens were there was because you broke them apart, or the liver's producing it, right? So you can measure the core antigen and the surface antigen. All right. So the surface antigen, it's going to measure that with blood donors, right? So after you donated blood, they're going to measure, say, hey, do you have surface antigen? Because antigen is found on the virus. If they do, that means they have that hepatitis B is there, right? That's there in the blood, right? For dialysis patients, why do dialysis patients need to get tested for Hep B? Because you are poking them through a fistula and has blood-to-blood contact over and over and over, right? And also, if you do have Hep B, can they not get dialysis? I'm sorry. So we got to have an end-of-life conversation over here now. No, that's not. What has to happen?
They have to have the hep.
They have to sterilize their whole machine between treatments, right? They're going to run a bleach cycle, basically, right? So yeah, so hepatitis B surface antigen, if that's present, that means there's an active hepatitis B infection. Hepatitis B is either being broken apart or destroyed by the immune system or being produced, and we can pick that up on a blood test, right? Same thing with the core antigen. The core antigen is just one layer deeper. Either one, that will tell you have an infection present, right? And if you do have an infection present, usually they'll measure the hepatitis B DNA, how much DNA is being circulated around as well, okay? So that's a hepatitis B virus DNA polymerase test. So they measure DNA that's present, okay? And envelope, we're not going to worry about too much, but then going down to antibodies. So antibodies are an immune response, right? So that's our response to the antigen. So are we forming a antibody or not, basically? If you are forming the antibody, that means you could be protected, right? Usually we give people the hepatitis B surface antigen, and we can then form the antibody against that, right? And it's going to take a second, right? We have IgG and IgM varieties. Which one's going to be happening first? IgM. So if you have an IgM against the core antigen, or you have an antibody against the core antigen, that's an anti-HBV C IgM, right? That is a sign that you have an acute infection, right? Whereas this IgG, that means you are immune. Basically, those are your titers that you're measuring. Okay, so that's the deal with hepatitis B. So I tried to not dumb it down, but try to make it as digestible as possible because it is not digestible. All you're going to know is there's a lot more tests for hepatitis B, and which one shows that you have a protection. That's what means you're forming what? You're forming antibodies, right? Against the core antigens, right? Sorry, the surface antigens. Because the surface is as the outside. So if you're vaccinated, you should be positive for the antibody against the surface antigen. Okay? So yeah, it is confusing. I apologize for hepatitis. Where's my cursor at?
Hey, so the Hep B antibody came back positive on Jones. Should we start him on therapy?
Which antibody?
Hepatitis B.
Yeah, but which one?
What?
Core, envelope, surface?
Core.
Which one?
Are you messing with me right now?
IgM or IgG?
There is no IgG. IgM is negative and total is positive.
So IgG is positive.
Okay.
Well, that could just be from a prior infection.
Okay, so like hepatitis A.
Kind of.
But IgM is negative.
True.
So I check viral load like with hepatitis C?
No, you need to check the antigen.
Okay, well the Hep B envelope antigen is negative.
No, surface antigen.
Oh yes, of course. How could I have been so stupid? Okay, Hep B surface antigen is positive.
So what's the viral load?
I thought you said that didn't matter.
What about the envelope?
It's positive. I already said that.
No, not the envelope antigen, the envelope antibody.
Are we going to pretend that hepatitis B magically gets multiple different types of antibodies when every other disease has one?
Is it positive?
Yes.
Probably just a chronic infection then.
Okay, so what do we do to treat that?
How are his liver enzymes?
They're normal.
Well, then we probably don't need to treat if the viral load is okay.
I don't know what the viral load is. We didn't check that.
Okay, well, please check that.
Okay.
And next time, try to wait until you have all the data before coming up with a plan.
Yeah, so it's annoying. So again, $150,000 a year, and we are stopping the cycle somewhere on the production of hepatitis B. We're preventing the DNA replication, right? So we have antivirals we can use. And the best mnemonic I can come up with is latte, right? Those are the different drugs that you want to identify that are hepatitis B associated. Because we talk about hep C, they have different antivirals, okay? So you can say first line is the entecavir and tenofovir. Those are antivirals that are going to mimic the building blocks of DNA, right? To make DNA, you need what? You need the base pair. Sorry, you need the sugar and the protein, but you also need the AT or G or C, right? You need, what does ATGC stand for? Tyrosine, adenine, guanine, cytosine. Remember back to this with chemistry, biology, right? So these are important. Now we're going to loop it back in because we have medications that are going to mimic those. And there's almost like Trojan horses. Like, here, try this drug. It's an adenine, and it's not. It's going to literally self-destruct on the hepatitis B virus. Like, the hepatitis B is like, oh, I'm great. Now I got a cool new adenine. And then it self-ruptures. And then the hepatitis B virus is then kaput, right? So we have all these ones that mimic those base pairs, okay? So that's how the antivirals work in Hep B. We do have interferon, so if you can't afford 150K per year, right, like most people can't, then you can get interferon. Interferon actually prevents the virus from entering the cell in the first place. And interferon is it's usually sub-Q, right? There's a pegylated version, which is PO, but you take this and you take it for, what, 26 weeks, 40 weeks or so, and it makes you feel like crap the whole time because literally it's like virus in a pill. It makes you feel all the malaise, myalgia, fever, chills the whole time you're on this therapy. So for about 48 weeks or so, it depends on which variety and how severe infection is, you're going to feel like this for that long time, right? And it's for chronic infections, and it's going to mitigate the symptoms, okay? And if you don't get rid of HBV, chronic HBV, that can progress to cirrhosis, which can then progress to cancer, okay? So ATGC, we'll come back to this when we talk about hematology and oncology and how that all interrelates, okay? So now we'll take a break.
Oh, okay.
All right, so finishing up hepatitis B. All right, so we're still on hepatitis. So over here on the board, you're down GI organs, liver. And we're going to spend a lot of time with liver because it has a lot of things going on with it. But hepatitis we're still on item 1. And we're spending some more time on it because it can be confusing. So that's the reason for that. Okay, so hepatitis B nursing considerations. So first of all, you can prevent it. How do you prevent it? Don't get it. Yeah, but what if you're a healthcare worker? You can't always avoid every needle stick ever, right? So you want to get vaccinated against it, right? So vaccine is the best way to prevent illness, and including hepatitis B. And if you do get exposed, you want to get post-exposure prophylaxis or PEP. This comes back when we talk about HIV. So I think HIV is down here. But for hepatitis B, you just basically get an accelerated series of hepatitis B vaccine. So I think it's 1 week, and then 30 days later, you get the hepatitis B vaccine, right? So that's the goal here, right? And your goal is to get it done within 24 hours of the needle stick. Acutely, if you have needle stick injury, you want to bleed out some of the hepatitis B if you can. I think that's just kind of like a sana ritual. It doesn't really do anything. But it's the other thing you're going to do is you're going to wash your hands aggressively with soap and water. Right? You could use alcohol, you could use chlorhexidine, you could do whatever you want. You're trying to just sterilize the site that got infected. And then cover it up until you can then get tested, right? And then, of course, they would test to see if you have what? What would they look at acutely to assess if you have hepatitis B infection? They can look at the IgM, right, on the surface. They can look at the surface IgM. They could look at the viral load, hepatitis B virus DNA or RNA? DNA, right? And they can also look at the level of surface antigen, like how much hepatitis B surface antigen is actually floating in the bloodstream, okay? So to prevent HBV, the other reason why you get HPV vaccine is to avoid complications with other treatments. So if you're getting HIV treatment, if you're getting hepatitis C treatment, ironically, you need to get a hepatitis B vaccine, right? Because if someone has hepatitis B already in the bloodstream, and it can take about 20 years for it to develop cirrhosis, if they already have Hep B dormant in their body, just waiting for that time 20 years later, it could reactivate, right? So HIV reactivates because now they have no immune response. Now hepatitis B is like, now's the time, right? Hep C treatment is going to be autoimmune in a little piece, in a little bit. And then biologic agents. So we've introduced biologic agents here and there, like we introduced them with Crohn's and ulcerative colitis, and also in in 103 in Med-Surg 1, talked about a few biologics here and there, like with multiple sclerosis and with asthma, right? They usually all end in MABs. Those are the most common ones, MAB, monoclonal antibodies. And those drugs literally are just antibodies against something. right? It either is against a receptor site, if it's against a specific bacteria, specific like IgE in asthma, right? Asthma has IgE, causes allergies, and we'll say, well, let's create a monoclonal antibody that attacks IgE so it doesn't cause disease. So monoclonal antibodies can be very great, but also they could put you at risk for other diseases such as hepatitis B. All right, so you have to get vaccinated before you get biologic agents. They usually end in MABs. There's such things as NIBs and SEPs, right? Like what's it called? Not Paracept. What's the one I'm looking for? CellCept, right? Is one. Chemotherapy drugs. Usually they get tested for hepatitis B because chemotherapy drugs are going to wipe out the immune system, and we want to make sure that a dormant HBV might not attack. Okay. And to prevent HBV, right? So mother-child, so within 24 hours of birth, they got to get a shot. As far as sexual transmission, we talked about anal greater than vaginal, like 18 times greater risk. MSM is a high risk population, right? So we want to make sure we're teaching. Needle sharing, we are not teaching needle sharing. We're teaching what? Not to do it, right? Tattoos, you want to make sure you research your tattoo parlor. Make sure they have the health department, they don't have complaints, right? And what else? Healthcare workers. So we're wearing gloves, masks, right? Why do we have to wear a mask? There's fluids that can fly into our eyeballs, right? So secretions can also be a reason for Hep B contraction, right? Disposable needles, so no recapping, right? Using one hand so you're not poking yourself, right? So often when you're drawing from a vial, you should be one hand as well for prevent hepatitis B. Yes, it hasn't been in the patient, but you don't want to get that exposure, right? What else? So healthcare workers decontaminate blood spills with bleach. So bleach is going to eradicate blood. You could do soap and water, but you're going to push it around. You're not really going to kill it. All right. What else? So autoclaved items. This is more like for OR when they sterilize reusable items like reusable hemostats. They have to make sure that it is properly sterilized. Otherwise, those hemostats may have been used for something bloody, and then for the next patient, we don't want to transmit Hep B. All right. And then screening for liver cancer, because Hep B is one of the most common causes of liver cancer. It can lead to liver cancer. Hep C can lead to liver cancer as well, but Hep B has a greater incidence. All right. So that being said, we're kind of getting ahead of ourselves. But for liver cancer, you're going to assess for it, and you can assess a blood test for liver cancer, and that is alpha-fetoprotein. So AFP levels will rise when you have liver cancer. So just like we can measure what for gastric cancer, CEA, you can measure AFP levels for liver cancer. And they get an ultrasound as well, be recommended to make sure they're not getting their cirrhosis getting worse, there's no tumors or anything growing. Okay, so we got wipes there, right? These are the wipes at both hospitals. They're SANI AF, right? Those are our SANI wipes. That's a not a peroxide mix. What is it called? An ammonia mix or something like that? What's the word I'm looking for? Either way, we have the hepatitis B vaccine there and different prevention strategies. And if you do get stuck, we have post-exposure prophylaxis that we're going to implement, right? So as far as we encourage patients to make sure they are using safe practices as well. Just as we practice safe practices, we want to make sure our patients are as well. So let's see here. That wasn't a one-hand recap. All right, so to make sure you're recapping with one hand, right, in the club, all right, you got to get your insulin going. It's like just had a shot, right? So I want to make sure that we are utilizing our same techniques, right? So we're going to make sure we use alcohol before we're giving it, and it's also one-handed. You did great on the injection, not so great on the recapping. What else? Stop this. All right, so hepatitis C. So hepatitis C, all right, so it's just HIV, HBV, HCV, right? So it is RNA, just like all the hepatitis except for which one? Hep B is DNA, right? Hep C is an RNA. So we can measure HCV RNA levels, right? If someone has an active HCV infection. Usually acute cases, they're not very common, but when they are, they can progress to chronic disease. And they don't really, they're not as severe as like a Hep A infection. Hep C is usually pretty mild. You're like, oh, that was interesting. I guess I had the flu. And you realize in 20, 30 years, now you have cirrhosis, right? Because you contracted it somehow. And how do you contract Hep C? All right, Hep B, D, and C are all blood and secretions, right? Ironically, Hep C is not so much secretion. It's kind of rare to get it via secretions, but it's quite more common, much more common to get it via blood. But it's more common to get HBV via blood if you had the option, right? But you can contract it via blood as the most common reason. So needle stick injuries, right? So remember, Hep B is more common for needle stick injuries, but Hep C is also a risk. How much of a risk? It's 1 in 30. So every 30 patients, or every 30 needle sticks you get, you have a chance of getting Hep C if all 30 of those people had Hep C, right? If all 30 people of those had Hep B, well, it's 1 in 3 risk. That means you have a 10 times risk of getting it, right? So every 3 patients that have Hep B, if you do a needle stick injury with their blood, 1 in 3 chance you're going to get Hep B. Hep B is much more infective and virulent than Hep C. All right, and transfusion, you can get it via transfusion, but it's 1 in a million chance, right? Tattooed body piercings, but most common reason to contract Hep C is usually IV drug abuse. So IV drug abuse is a reason for Hep C contracting via the blood, right? You're sharing needles, and then not really very clean with that. But also, if you were born between the years of 1945 to 65, that 20-year period there, it wasn't until 1965 where someone said, you know what, we should not reuse needles on patients. We should probably dispose of them and use a new needle for each new one. So in the hospital setting back then, that's what they did. They reused needles. It's like just, you're done Mrs. Jones, your insulin shot, wipe that guy off. Okay, here you go, wipe that guy off, here you go, right? So they just went around and reused needles. So they were IV drug abusers in those years. So if they were born during those times, they would need to have they'd be high risk for Hep C. So we should test them and make sure that we're identifying that population as a risk factor. Okay, body fluids, it can go via mucous membranes, but it's quite rare. Hep B is much more common via secretions. Okay, so again, chronic Hep C is what progresses to cirrhosis. It takes about 30 years for that to happen. So your activities in your 20s are to catch up to you in your 50s. Okay. But cirrhosis, again, what's more virulent is Hep B. So Hep B and C lead to cirrhosis, but Hep B does more often than not. Okay? And whenever you have cirrhosis, you're at risk for cancer, which is hepatocellular carcinoma. This last guy right here. All right? And it leads to ESLD, which is end-stage liver disease. Okay? Cirrhosis is kind of like being diagnosed with CHF. It's another chronic disease state that we have to manage. We have to manage the complications. We have to manage the frequent rehospitalizations. And we have to recognize those symptoms and teach all those symptoms. There's a lot of complications that can happen with cirrhosis, which is going to be the next part of our lecture. All right. So HCV. So those are our teaching tips. The bottom left there. A little recap in the bottom right on which one's fecal oral, which one is by blood. Okay. So avoiding contact with blood is going to be your best bet. Don't reuse needles. Don't be born between the years 1945 and 65. And also, IV drug abusers usually reuse needles as well. All right, so HCV pathogenesis. So how do you get HCV? So it actually, again, it is by blood. Most commonly, it somehow got into the bloodstream, and it makes its way down to a hepatocyte, which is on the right-hand side here. Right, HCV makes its way in, and it's going to get in, and it's going to take up shop on the endoplasmic reticula. What the heck is the endoplasmic reticulum from biology? That's where the ribosomes be, right? And the ribosomes do what? They make proteins, right? Also, the ER, endoplasmic reticulum, is also a storage spot for proteins. It also kind of assembles proteins like a little factory, like the industrial district, like in east of Sierra Highway, right there. That's where all the industrial things are. It's where they assemble proteins and things, right? So Hep C takes up shop there. It does not take up shop in the DNA, right? So we really can't give things that mimic DNA parts, right? We got to do things that destroy the packaging process, right? We can give antivirals that are interferons that are going to interrupt the entry altogether. We can do that with interferons that can be given. So interferons can be given as well. But usually we're going to give medications that are going to stop the processing and packaging of that protein. So you can see we zoomed in on the endoplasmic reticulum right there. All right, we zoomed in at the bottom half over here, and that's going to be this little protein pathway, this little assembly line. And we are going to give a medication that's going to block different parts of that assembly line, that different packaging process. Because if it is uninterrupted, it's going to make what? What are these called? lindens or something, right? So those aren't Legos. That's not something that the hepatocyte is supposed to make. So it makes that, and encapsulated inside of it is RNA, right? And that's a Hep C, and the Hep C can then proliferate. So you give these medications to stop that, right? The difference between Hep C treatment and Hep B treatment is which one can have treatment of the acute phase. Hep C can. Hep B, you just tough it out, right? And you give medication for the chronic process. Here we have medications for the acute and the chronic process. Okay, and there's 6 different genotypes. It gets really hairy. That's why you recommend them to a hepatologist. What's a hepatologist? It's not someone that has herpes. It is someone that studies the liver, right? So a liver disease specialist, because there's all kinds of, it'd be on the right treatment. There's all kinds of combinations based on what genotype of hepatitis they have. They could have Hep C genotype 1 or genotype 2, and they all have, I'm sure, the different names based on the guy that discovered it. But basically, these are the medications that some kind of combination you're going to mix, right? So ribavirin is actually kind of always mixed with something. That being said, they're all combos, right? So hepatitis B was just one drug usually, right? It cost you $150,000, but it was one drug. Whereas here we have multiple drugs. We have combo drugs. Usually it's 2 drugs minimum, all right? It's not like HIV. HIV gets crazy. HIV has like 3, 4 drugs sometimes, a whole combo, like multiple combos. But Hep C has just usually a dual therapy. Like down here you can see we got ribavirin and sofosbuvir. Right? It's like, what the hell is this guy saying? So sofosbuvir, that is a vir, it's an antiviral, right? So it's a medication that's going to interfere with the production line right here, so they can't make their fake toys. Okay? So you just want to recognize that these are Hep C, and they're different than Hep B, and also that they are given in combo, right? So that's kind of where we're at with that. We don't want to know about side effects except for maybe interferon. Interferon has what kind of side effects? Has flu-like symptoms. You're literally giving something that's it's your body's natural response. Your body naturally produces interferon that interferes with viruses from integrating into cells. So you're just giving a synthetic version of that, right? So what else? So what are you going to have with an acute infection? Just like HIV, you're going to have some jaundice, right? And you're going to have some, if you have jaundice, what labs will be elevated? I'm not sure if it's the connection or what it is. It's causing it to be fuzzy. So what kind of labs would be elevated with a acute hepatitis? ALT will be elevated more than AST. Good. So you'll have elevation of the transaminases, where you have alanine and aspartate transaminase. They call that transaminitis. I didn't point that out in the other slide. But transaminitis is just a fancy way of saying that they have elevated AST, ALT. And which one is more? That's your ALT, if it's a viral infection, right? L for viral, L for ALT. It's slowly coming back. It's like a dial-up connection. Anyways, we got a combo breaker, right? These are going to be breaking these different parts of the assembly line. Okay? So we have protease inhibitors, nucleotide analogs. We got different packaging disruption, right? And the cost is not cheaper than Hep B. It's still a crazy amount of money to be on these therapies, right? So it's barely out of reach for most people. So they're usually going to be on interferon most commonly. All right? Any questions on how Hep C is treated? Again, they can look at also HCV RNA. Usually, ironically, there's not many, you don't really form antibodies to HCV. So it's usually just the HCV RNA, and you'll see the jaundice-like symptoms. All right, so this is how you feel after reading all those medications.
Dingle bongle, dingle dangle, yickety doo, yickety da, ping pong, lippy tappy too.
Okay, so those are your HCV. All right, so hepatitis D and E. So this is just a summary slide of all we've been talking about. So this should all make sense about A, B, C, D, and E. The only thing we haven't touched on was D and E, but which one needs Hep B to survive? D needs Hep B to survive. You can't just have a Hep D infection. You have Hep B and you got Hep D, right? It's very uncommon in the U.S. It's usually endemic to like South Asia, India, okay? There's really no treatment. You just give hepatitis B vaccine and hope for the best, right? Hep B is also rare, right? And it is a bowel, therefore it affects the what? The bowels, right? So vowels of the bowels, A and E are fecal-oral transmission. Okay, so again, this slide is going to summarize all the things we've been talking about so far. All right, and the big thing that we're getting to next is what happens if you don't treat it acutely. You're going to start to have cirrhotic changes. After a while, after about 20, 30 years, 20 years there, then you'll get cirrhosis. But all of these can have an acute phase, right? But then some more than others, like Hep A definitely has an acute phase because it does not have a what? Chronic phase. It has no chronic phase, right? Hep D, E really don't have chronic phases. Hep D just is like a super infection. But Hep B and C are the ones that are what? Are chronic, right? And can lead to cirrhosis. And if you, before we get into cirrhosis, eventually worst case scenario, cirrhosis can lead to what? Cirrhotic complications, including one of those being hepatocellular carcinoma, HCC. All right, so those are all the letters and such for hepatitis. And then we can finally move on to something else.